Dispatch 8001. You can show us around Hamilton ×1.
If you live in a rural area and require immediate medical attention, how long will it take for you to receive help? And with the recent strain on hospital space and staff, where will the emergency crews even take you? The answer to those questions and what's being done to help with response times and patient care is this episode of Good Roots. The vast majority of Arkansas can be considered rural, with populations heavily consolidated in only a few areas. For most Arkansans, medical care means travel, and for some, a considerable distance, whether that's for a traumatic event, an earache, or even to get a vaccine.
I'm Robert Thurlby, retired from general internal medicine practice in Russellville and Dover, Arkansas. If someone is moving to a rural area, they need to do research. The ambulance practice, number of specialists, what's available in their town that they're going to be dependent upon, particularly if they've got an ongoing medical problem that requires some sophistication. The ambulance program has improved. They've moved out into some of the boroughs and they're reaching people earlier. Also, 911 can get you a helicopter in quickly.
In many instances, emergency medicine starts with lights and sirens, ambulances, and fire trucks. For Arkansans living in more rural areas, it can take up to an hour or more for an ambulance to reach the scene. Much of that depends on staffing, locations, access, and equipment. I have first-hand experience in rural EMS, responding to all kinds of emergencies, from traumas and car wrecks, diabetic, cardiac emergencies, after spending 8 years on an ambulance. What is MedTech and what do y'all do?
MedTech EMS of Conway County. We provide a paramedic level service for all of Conway County. We have 2 primary trucks that are paramedic level trucks that we staff 24/7, 365 days a year.
All the time?
All the time. And then we have a reserve unit that we can staff fairly quickly if needed.
If all of the trucks are out, it does.
And that does happen, yes.
So y'all cover the entire county. So how long would it take to get to the outskirts of the county?
Probably at the max, running code 3, which is lights and sirens, and pending traffic gets out of our way, about 30 minutes.
About 30 minutes, okay,
yeah.
on the long side. So what has COVID done for EMS?
It's been a big challenge. So with COVID, it's slowed our response on every other call, basically, because when we have a COVID transport, we have guidelines we have to follow, protocols. Once they have transported the patient, they come back, they have to completely decontaminate the unit, and then they have to decontaminate themselves, which means shower, change of uniform, everything. It's been tough. And our guys, it's real, when you think about the long extended transports that they have sometimes with COVID, they're in either an N95 mask or a half-face respirator mask. They have full, gown, suit, Tyvek suit on, so it definitely wears on them. They see the effects of COVID and what it's doing to their patients, and it definitely wears on them.
What biggest challenges have you seen at the hospitals in dealing with?
At the hospitals, it's been wait time. Everybody's doing their best. Let me start with that. Everybody's doing their best. It's just, this is a territory we've never seen before. All of the COVID beds are taken. Just the other day, we made a transport all the way to Mena. That's a 5-hour turnaround time for a transport to Mena. So there's no specialty necessarily that our hospital doesn't have. It's just they have COVID units, a COVID unit. So, and that was the only COVID bed available in the whole state at that time.
EMS typically take patients to the closest emergency department. However, many times in rural areas, they are inadequately equipped and staffed to deal with the most severe cases, and the patient is better suited at a higher level of care. For example, a larger hospital in Little Rock. Pediatric surgeon Dr. Todd Maxson is the chief of the trauma system at Arkansas Children's Hospital, in which he helped to create.
And unfortunately, the beds in our trauma centers are at or near capacity. The impact that I've seen from COVID on the trauma system is pretty significant. I mean, we really have 2 goals now. We must continue to provide outstanding care, but we've got to protect ourselves, because if we're infected or we spread this, then we just simply don't have the personnel to continue to perform. It's almost a daily analysis of whether we're going to have enough space to continue to do this. So everything we can do in the state to curb the spread of COVID has such important downstream effects for us.
The Arkansas Department of Health, along with several other private healthcare providers, have begun to focus on establishing COVID-19 vaccination clinics in more rural areas across the state in an effort to provide all that would like to receive the vaccine an opportunity. You can find that list on healthy.arkansas.gov.
I feel that rural Arkansans definitely have access to vaccine. And people will call me and ask me, should I take this vaccine? And my answer is yes. Both my lovely wife and I have both had COVID-19, the disease, and we both had dual shots. Our case incidence is going up. You know, we're leading the United States in 2 areas, both of which are bad. Let's do something about it.
We have so many healthcare workers that have been out from COVID or are continuing to be out from COVID, so we've got to get ahead of this. It is absolutely changing what we do.
Living in rural Arkansas offers many joys, but healthcare is an aspect of life we all must face. For Good Roots, I'm Logan Duval.
Major funding for Good Roots is provided by Arkansas Farm Bureau.
Arkansas Farm Bureau, advocating the interests of Arkansas's largest industry for more than 80 years. Arkansas counts on agriculture. Agriculture counts on Farm Bureau.